Hi, my name is Redmond Burke. I'm the Chief of Pediatric Heart Surgery here at Miami Children's Hospital. If you're coming to us, your baby probably has a complex congenital heart defect. So I'm going to introduce you to the team today. I'm going to take you through what you and your baby will experience when you come here for your open heart repair. Our goal is to treat your baby in the least traumatic way possible, not just for the time you're here, but over your baby's lifetime. And this video is going to give you a chance to see exactly what you're going to experience when you or your child come here to have open heart surgery. If your baby's been diagnosed with a congenital heart defect, the first time we meet might be right here in my office. I want you to have every question answered. And when you get here, we're probably going to go over what your baby has and how we're going to repair it. I might use a model to show you exactly what the baby's heart defect looks like after we've had our discussion and all your questions have been answered. If your child is over 3 years of age, we'll probably have your child meet with a child life specialist. So the child life specialists are certified, and their goal is to prepare your child for coming into the hospital for heart surgery.
So I'm going to help teach you guys about what the doctors and nurses do to help boys and girls' hearts get stronger. Okay? And I was hoping you guys could help me out. You guys are going to dress up like surgeons, and you're going to help me repair this doll's heart. My name is Regine. I'm one of 16 Child Life team members that are educated in child development and education of children and families. Our main goal is to prepare children and their families for their journey during their hospital stay here. Child Life specialists help children understand on their own cognitive level on what their actual diagnosis is and how the doctors and nurses are going to help repair their heart. So the way that we give the anesthesia is we're going to first put this soft mask. I want you guys to feel that.
Wow, that's
okay,
really soft.
Over his nose and his mouth. Can we put it over Chris's nose and his mouth? Children tend to fare and cope better with their hospital stay after they've had an opportunity through medical play to learn step by step on how we're going to repair their heart. And we know that parents, it's a very agonizing time for them. And our goal also is to help them understand and make it a little bit easier for them in explaining to their child about their upcoming surgery. And studies have shown that giving children the opportunity to become familiar with the hospital environment has helped them cope better through their hospitalization.
The Cardiac Intensive Care Program at Miami Children's Hospital is the first of its type in the state of Florida. We take care of children from newborn to adult age. We have done what we do, which is taking care of children with congenital heart disease who are critically ill for longer than any program in the state of Florida. And our success rates either rival or surpass the success rates of any program in the United States or the world right now.
We have a dedicated group of pediatric cardiac anesthesiologists that solely perform anesthesia for cardiac patients. And because we work with the same cases every day, we have a level of proficiency and effectiveness that I think exceeds any of the other programs in the area.
Here at Miami Children's Hospital Cardiac Intensive Care Unit, we understand that the recovery phase of your child can be very overwhelming during the post-operative care period. For this reason, this segment explains what you're going to hear and see once your child reaches the critical care intensive unit.
After surgery, your child is continuously monitored while in the cardiac intensive care unit, both at the bedside and centrally. We monitor your child's temperature, blood pressure, and respirations, and we give medications through IVs to treat pain and to help the heart, to ensure that we're doing everything possible for your child's recovery.
Hi, my name is Linda Rusanowski, and I'm one of the 12 nurse practitioners here at Miami Children's Hospital Cardiac Program. I specialize in the care of the patient both prior to and after open heart surgery here at the hospital. After surgery, you can expect to see many things connected to your child, all of which are necessary to help us monitor them as well as give the medications required to take care of them after surgery. I'm going to start by explaining a few of the things that you're going to see on your child after the operation. First thing we're going to talk about is the nasal cannula. This provides oxygen to the baby to help them breathe after surgery. Next, you'll see these electrodes that are attached at multiple places on the baby's chest and abdomen. These will help us monitor the baby's heart rate during surgery and after surgery for the next several days. You will see little steri-strip tapes along the incision, as well as the chest tube sites. These steri-strips are put on after the surgery in the operating room to help close the incision to help it heal. You'll notice that there are no sutures involved, as these steri-strips will stay on as the wound heals and will fall off over time on their own. Below the incision, you will see some drainage tubes that come out from the bottom of the incision. These are called chest tubes. They help drain any extra fluid or blood from around the heart or the lungs after the surgery. You can expect that these chest tubes will come out approximately 1 to 2 days after the surgery. You will also see another tube that's connected to a ball. The ball is filled with numbing medication that helps numb the incision site after surgery. This line also will stay in approximately 1 to 2 days after surgery to also help keep the area free from pain post-op. Next, you can expect to see several IVs that are placed in the operating room while your child is asleep. First, this is the arterial line. It's placed to help us monitor your baby's blood pressure in the operating room and post-op for several days. This line will be taken out in the ICU by the nurse at the bedside. Next, this is called the central line. This is a large IV that's put in by anesthesia in the operating room, and it's used post-operatively to give medications or fluids. And this again will be taken out at the bedside by your nurse once the doctors decide that it's no longer necessary for the baby. Next, you may see some smaller IVs that may be in the feet or the hands that are called peripheral IVs that are just also used for us to give extra fluids or medications as needed for your baby post-operatively. You'll also see a blood pressure cuff attached that we can monitor your baby's blood pressure in addition to monitoring the blood pressure on the arterial line. Lastly, you'll see a tube that's connected to your child's bladder to help us monitor the child's urine output after surgery. This will also be removed approximately 1 to 2 days post-op. The care team will monitor your child's progress on a daily basis and keep you informed on what tubes and lines will be discontinued.
Here at Miami Children's Hospital, we encourage our families to be part of their child's care each day. For this reason, we encourage your participation in collaborative, family-centered rounds and interdisciplinary rounds each day. During rounds, they have the opportunity to ask any care questions or any discharge planning questions that they may have. The unique collaborative team approach here at Miami Children's Hospital ensures that all our children receive the highest quality care possible. It also empowers all of our families to feel like they're a vital part of their child's recovery.
Our program is a huge team effort, and it's never just one person involved in the care of your child. It's an entire team. There are uncertainties in the care of children with congenital heart disease. We never know exactly what we're going to find inside the heart until the heart is open. But there is one absolute certainty in the care of your child, and that is that we will take care of your child like they were our child, our son or daughter. That's the commitment of the entire team.